So that Mark, thank you, Mark, invitation, and thank you, Monica, to organize this meeting. Dr. Smith already mentioned to you is that addiction is a brain disease. And so I'm going to present you the one many years starting from Dr. Nora Volkov and I. We are using brain imaging method to show how addiction affects the brain. So I'm sorry about this white block, and that also looks okay. As we know that the dopamine and a lot of these drugs that affect is our brain dopamine system. And this dopamine system started from that middle of the brain, midbrain, and they protrude their innervation to the so-called reward center in nuclear accumbens and also to the frontal cortex. And so that allow this medication related even including the food, that once you have it, and then that will increase the dopamine release into the brain. So for so many years that we use that positron emission tomography to study the brain by labeling that medications to the short-active short-life isotope such as carbon-11 or fluorine-18, that we inject the tracer into the body and then eventually reach to the target organ, such as the one we have the study of the carbon-11 rockopride to the brain dopamine D2, D3 receptors. And this actually is pretty data being used for cancer studies. And so for many years, we found that not only cocaine, other drug of the abuse, such as methamphetamine, alcohol, heroin. Later on, other people also showing that cigarette smoking and all affect the brain dopamine D2 receptors. As you see that compared to the normal control on the left panel and age-match control in the left panel and the right. You can see that they all have the low dopamine D2 receptor. It's such that those people, they have the low dopamine D2 receptor. They need to use substance to compensate their deficiency, and so they have to keep using the drugs. And lately, we also found that it's very interesting is that we want to understand how the drug that affect the, and so if that they have recovery and then they may be will better off, and that so I have the grant to study for 5 years, and in the person actually come from that California because that is a epidemic in that West Coast, so that we had to fly them to New York to scan them. And after 4 years, 4 years study, and then I found that after a period rehabilitation, and then 16 subjects only, 17 subjects only 11 subjects returned. And so I studied them, and that later on, a year later, we scanned them. I cannot see any differences. I said, gosh, what happened? I waste the government money. But actually, I said, I think it back, and then I found those 6 subjects, they disappear. And then turned out these 6 subjects, they have much worse off from the beginning. That's why they had to escape, because in the California law, if you relapse, you use a drug, you go into jail. And with such of the rigid rule, and that those people, they have worse brain dopamine system. In the beginning, they escape. They go to other state. Or they even, some of them went back to jail. So interesting is that, so there are people, they have a little bit worse. These people, they are easier to recover. And that is the result of the study was published a few years ago. So we also found that there are problems in the drug abuser by using radioactive sugar, radioactive glucose, and then we found that it's very interesting is that some of the drug abuser, such as that cocaine abuser and methamphetamine abuser, they have lower brain metabolic activity in the frontal cortex, such as orbital frontal cortex, just the cortex about the eyeball, and a little bit higher area, such as anterior cingulate gyrus. And we found that this is happening in some of that drug abuser, such as cocaine abuser, I'm showing to you. And we found that it's very interesting is that in the cocaine abuser, compared to the, I mentioned to you the decrease in the dopamine D2 receptor. And we found that those cocaine abusers, they have the lower dopamine D2 receptor, also have the lower metabolic activity in the frontal cortex. And that frontal cortex is the one related to our planning and our control, what we want to use. And then this is like a vicious cycle. If they have the low dopamine D2 receptor, they also have the low control of themselves. And so they keep using the drug. And this is not happen in the cocaine abuser, also happen in the methamphetamine abuser. With the time move on and the development of the MRI, and then we use this instrument that keep going to study the brain. And there are several methods can be used to use this to see, such as visual acuity or working memories, and then that we can see how the brain circuit. And so this is much improved because they have much better resolution compared to the one we use, such as radioactive sugar. So this is a study published by our colleagues that, using that meta-analysis of published articles from year 2001 to 2011 is that about 44 articles he can collect from the internet, and showing that the alcoholic, cocaine, methamphetamine user and the marijuana user, they have the very common phenomenon is that they have the low activity in that anterior cingulate gyrus. And he also collect around 14 articles showing that obese and eating disorder subjects, they also have a very, very similar less response in that anterior cingulate gyrus. And also compared to these two, he found that obese and eating disorder person, they have the more of the problem in that area, such as hippocampus. Those are related to our memories. And keep moving on that he also, this is by Dr. Tamasi from our laboratory, and shown that by using a methodology, so functional connectivity to see the brain, and that is a new method to see how the brain connect to each other by using the pixel by pixel, and to see how one area compared to other areas. And the last he found out is that there are problems in the cocaine abuser, is that he used the area such in the midbrain, because all these drug abusers, they have problem in their midbrain. In the midbrain, he see the connections, and he used the method to see that functional activity, he found that this group of that cocaine abuser, they have the problem in connection between that orbital frontal in the midbrain with that anterior cingulate gyrus and middle of that thalamus and some of the cerebellum. And not only that, he also found that this is also related to the problem using that functional MRI in the area of all these areas. And so he also found that there is a significant difference, especially in the area of the cocaine use related to this functional connectivity or between the midbrain and to the thalamic area. Basically, that I want to explain to you is that using the brain imaging study that we can see that as nuclear accumbens is an area with a silence, and for a normal person, usually we have that memory of the things. And for example, I see the apple, I want to eat it, and then I say it's good, and so I'm going and eat it, and then I have very good control whether I want to eat it or not. For example, I feel bad, I don't want to eat it, or I'm in a meeting, I cannot eat, I don't eat it. But for the drug abuser, it's different because they have such of the saliency, and the memory of that is so powerful, and that then the drive gives them a very good drive. But the problem is that they also lost the control, as I mentioned to you. Then they go ahead and use it. It's just different from the most of the normal non-addictive brain. And so that's for my